Okay, I'm not really much of a camera guy, and I usually screw up on talking a lot, but I'm putting this out there to try to help somebody so they don't have to go through what I had to go through, which I'm sure there's a bunch of people that are going through this. My problem started in 2001 when I was 21. I went to a doctor. Pretty much what happened was I had the flu for about 2 weeks, normal flu. It went away, except for on my right side, all the flu symptoms still feel like they're there. Which is, I feel like a weird ear pressure, swollen lymph node feeling, like right here, on the right side of my throat, on the very back. It feels like there's a raw patch of skin, or like it's been burned by hot cheese or something. Underneath my tongue, it kind of feels like a burning sensation. These feelings have been there since 2001. They haven't left. They're there all the time. Every time I breathe in, I feel like a cool sensation on that side of my on my throat. It feels kind of like peppermint, like if you eat peppermint, but it's more like a stinging, tingling sensation. I went back to a doctor and told him the issue that it's been going on for a couple months. They started giving me all these antibiotics. They weren't helping me out, so he sent me to an ear, nose, throat specialist. By this point, it had been going on for maybe like 6 months straight, and it doesn't come and go. It's just there, and it gets worse, especially if I'm sick. So they took CT scans like in 2002, didn't see nothing wrong. Kind of blamed it maybe on my sinus condition, which I kind of feel is related to this whole syndrome stuff I got going on. And he pretty much told me I was fine, and where the area I was feeling, it was right by my tonsils, so I pretty much kind of talked this doctor into taking my tonsils out. Which he did, and he kind of told me he didn't think it was the problem, but I wanted something done because I want to be fixed. I ain't like feeling like this all the time. I also feel fatigue, like I'm running on like 70%. It's almost kind of like having the flu in a way, but only on one side of your face. So he took my tonsils out. It didn't fix the problem. I went back and saw him. He ended up sending me to a cancer center, and they did a bunch of blood work, a bunch of tests, and came up with that their assessment, according to this paperwork, it's old, as you can see, 2002, showed the cancer ladies said that I didn't have cancer, but she thinks I had lymphopathy secondary to persistent sinus turbinate congestion. Pretty much they're blaming it on my sinuses, that I breathe through my mouth primarily, and that's why I'm feeling this, even though I've had this sinus condition like my whole life. So they just pretty much told me I was fine, you should go home, nothing's wrong with you, and that's what I did. I just was living with it, and I went and just lived with it. I was like, man, I don't like living like this. And after about another year, I saw another ENT, which stuck this weird microscope down my nose, going down my throat to take a look. Ran blood work, told me there was nothing. I brought my old paperwork, which I kept, to try to let them know, like, hey, this has been going on for a long time, something's really wrong with me. It doesn't really matter to them. To me, it kind of made me, to them, it made me look like I was crazy, since all these other people had already checked me out, or I don't even know what they were thinking. I saw an oral surgeon because it almost feels like a TMJ slight pain. There's like a pressure feeling always right here in my jaw. They didn't have no answers for me. I ended up seeing 3 of those. finally in 2008, which was about 7 years later, I saw a fourth oral surgeon, and I'd already been through about 7 ENTs, had the same procedures done. I come on my paperwork and they run their test and give me blood work and stick that tube down my nose, which I had done maybe like 4 or 5 times, to tell me the same thing over and over again. Finally, this oral surgeon, I think his name and everything's on here. I'm in Orange County, California, by the way. Took this panoramic x-ray, and I'll try to point it out. But you can faintly see it right here. That is a calcified, elongated styloid process with this Eagle syndrome. I want to show you the whole view of this thing in case you want to try to get a panoramic look for yourself. But it looks almost like a fang. So after about 8 years, by the way, one of the ENTs took out my adenoids during that 8-year period with the same thing, thinking that if my congestion clears up, that the feeling I'm feeling in my ear and throat's going to clear up, which seemed to be kind of like a scapegoat that they all use. So I had this now, and the diagnosis Eagle syndrome. I took this to an ENT about 6 months later because I didn't have insurance at the time, and told him I've been diagnosed with Eagle syndrome, showed him this. He didn't want to look at this because it's not a medical x-ray. Let me find that. That was in 2009. As you can see here, it says Eagle syndrome. He took an x-ray. The x-ray didn't show it. I know now it's because normal x-ray won't show it. It just gets meshed in with everything else. You can't really see it. I've learned that if they take the x-ray from the back of the head, they might find it if they really know what they're looking for. I mean, they knew what they were supposed to be looking for in here, but said I was fine. Said order maybe an MRI, a CAT scan, that might help. So he did, which I got right here. Same thing. It didn't show it. He took the CAT scan. It was my second one during this period trying to get fixed. He told me I didn't have it, even though I had this panoramic x-ray. I believed him, of course, because he did what he did to look for it. And he started me on acid reflux pills, thinking that maybe it was an acid reflux problem. He also mentioned that he thought maybe I should see a neurologist, but when I had this in my hand and he wasn't looking at it, and the problems in my throat, I'm just thinking like I wouldn't really listen to him that much because I felt this was what was wrong with me because I had a diagnosis. He started me on the heartburn medication. I believed him, tried to believe him, took it for like 2 months. Was like, fuck this. You know what? I'm going back to this oral surgeon that diagnosed me. Paid for a second one of these. It showed up again. This guy, Paul Braun, called that ENT, told him, look, this guy has this condition. At that point, the ENT had his secretary call me and told me he doesn't deal with that condition all of a sudden. Or he's not comfortable with the surgery, and recommended me. The funny thing is, to the same doctor that took my adenoids out about 4 years prior. I didn't want to see that guy. He was out of my medical condition. I mean, I wouldn't like to see him because just so he knew there was something wrong with me. Because after the adenoids were taken out, he just said I'm a mouth breather. That what I'm feeling is probably because of the fact that I'm congested and I breathe through my mouth primarily, which is always been there since I was a kid, but all of a sudden when I was 21, I got these other feelings going on. Called around, found an ENT who dealt with it, which was a pain in the ass to really do. because it's so rare. Not too many doctors want to perform the surgery, and not too many people want to be the first patient to have it done by that doctor. So it's kind of a weird thing. So I found a guy, and what he did was I went and saw him. He didn't think I had it, but he knew enough to get the CT scans and look at it in a three-dimensional image, which I didn't have to take another CT scan. He called up the radiologist place and asked to look at it in that image, which is more like a three-dimensional image of your skull. I think it's almost called a tomograph. And that is the best way for this problem to come up. I got another picture. This isn't really mine, but that's the styloid process. It's supposed to stay soft, kind of like a fish fin, but when you have Eagle syndrome, it grows extra long and turns into bone. So you pretty much have like a foreign object in your throat that's pressing up against everything. And he was willing to operate on me, which I was thankful for. And in July 10th, 2010, he did the surgery. It was a pretty scary procedure, considering how rare it is and how much trouble I had to even get diagnosed right. But it really wasn't that bad of a procedure. I mean, I was in and out of the hospital the same day. That was in 2010. Now, what that fixed for me was during this 10-year period, I would constantly push on my jaw like this on the opposite side, because this is the side that hurts, which kind of relieve pressure. It almost feels like a TMJ feeling. The pain is like from your ear and your lymph node in my throat and my back of my skull right here. It sometimes goes behind my right shoulder blade, right between the spine and the shoulder blade. And so he did the procedure, and what that fixed was I no longer twitched my jaw or pulled on it the way I did. I used to do that like almost 100 times a day. It was kind of embarrassing, but it just, the pain was just crazy. And it probably took the pain down like maybe 20%, if even that. But it definitely stopped me from twitching my jaw all day long and pushing on it, which sometimes I'd even want to just grab my teeth and kind of try to yank my jaw out. And it fixed that, but it didn't fix what I was feeling, which comes to find out, it seems like with a lot of people with Eagle syndrome, that's what happens. Like, some of them, they get the bone taken out and all these feelings are gone that I'm feeling. Other ones like me have the procedure done and there's still an issue going on, which I thought I had to live with. I kind of was just thinking, fuck, I tried everything I can. I got this bone taken out. Something must have got damaged by it. Like, I didn't know what to do at that point because you're not really getting any guidance. Everything I'm doing, I'm just pushing myself. There's like nobody around me understands it. Nobody wants to hear you complain about it all day long. Nobody even wants to